Hello, everyone. This is Crystal Hertz, Manager of Research and the Dr. Susan Love Research Army, and I am here to really get this webinar kicked off and talk a little bit about our presenter, Dr. Darabos. So Dr. Darabos came to us in 2019 looking to recruit for her research project, Technology-Based Communication After a Cancer Diagnosis. And the purpose of the study was to learn how technology-based communication can be used to support young adult cancer patients and survivors. The goal was to enroll 60 women between the ages of 18 and 44 diagnosed with stage 0 to stage 4 breast cancer within the last 5 years. After recruitment, participants were asked to complete an online survey and participate in an optional communication task. The initial call for action of the study was on January 19th, 2019, and we were successful in recruiting 58 women interested in this study. So I'll let Dr. Darabos take it off from there and tell us about some of the results from her research study. So thank you so much for joining us, everyone. And Dr. Darabos, go ahead and take it away.
Great, so welcome. Thank you, Crystal, for the introduction. I'm gonna spend probably about the next 15 or 20 or so minutes talking a bit about this research project, which really, like Crystal was talking about, really aimed to get a better understanding of how young adults with cancer are talking about cancer-related topics within their social networks. So with that, really the goals of this webinar is to talk through the rationale for this study, to present our study results and talk through any implications for our study findings, and then open it up to discussion. Okay. So I just wanted to start by mentioning when we think about young adults with cancer, many young adults report that obtaining support from one's own existing social network after a cancer diagnosis is really challenging. When we talk to these young adults, when we read kind of the literature around this, we find that young adults often mention that family and friends act like nothing has happened, that they express kind of no interest in learning more about their cancer, and that family and friends are really kind of unwilling to talk about their own feelings. Young adults also kind of mentions that friends specifically really have started to distance themselves or suddenly stop communication. In response to this, young adults often feel like their social environment finds dealing with cancer to be kind of too difficult of a situation. And so in fact, the primary psychosocial challenge that young adults kind of express is experiencing these altered social relationships amidst a cancer diagnosis. So what we know specifically about social support among young adults with cancer is that higher levels of social support among young adults with cancer have been associated with a lot of things. Higher social support has been associated with lower depressive symptoms, lower stress, lower severe grief. It's been associated with better psychological and existential quality of life, biologically through lower inflammation levels. And then higher levels of social support have been associated with greater frequency of sexual experiences and better sexual functioning among young adults with cancer. However, really to start to understand cancer-related social support processes, it's really important to kind of take a step back and kind of think through how is the support elicited by the young adult, meaning how are young adults asking for support when they need it? How are they reaching out for support? And then also to consider how support from their own social networks is perceived to be provided. So as a part of this study, we actually, set out to try to figure this out. So we asked young adults with cancer what they find to be the most helpful to them. When you're engaging in cancer-related conversations, what do you find to be most helpful for you? And these are some of the quotes that we heard from young adults in our study. Listening, creating a space in which I can be vulnerable and honest about my experience. Also has been really meaningful when somebody recognizes and responds to basic needs that they can see that I'm facing. Allowing me to talk about the realities and ramifications of my diagnosis without dismissing them. And also expressing how the thought of cancer still weighs heavily on me daily. So these first few quotes here really kind of resemble what disclosure is helpful for the young adult. These next few quotes resemble what might be helpful for support networks when communicating with young adults with cancer. So these young adults have said, when I first got diagnosed, it was most helpful for people to just be with me and let me talk about it on my own instead of having them pry it out. As much discussion as possible, knowledge and reassurance, patience, them not getting upset, and then listening and accepting without offering quick fixes or asking me to at least appreciate that I'm alive. So taking these quotes and kind of social support into consideration, I became really interested in how these conversations are taking place. We know that kind of most of the social support literature tends to focus on face-to-face conversations. So we know that talking with a supportive other and having that close physical contact is good. However, we don't know too much about how this support is kind of unfolding through technology means interactions. And we also know that young adults are increasingly turning to these kind of interactive technology platforms, whether it's social media or text message, as a form of kind of soliciting and eliciting cancer-related support. So we really wanted to figure out, is this helpful for young adults? So that kind of brings us to the present study. So like I said, we know that kind of relational processes, which I'm conceptualizing as social support, is associated with lower depressive symptoms and better functional well-being. But what we're really interested in is there a difference for those that have conversation via face-to-face versus those that are having these conversations via technology-related communication? So that's really what this present study set out to explore the role of communication, face-to-face or technology-related, on the relationship between these kind of social support-related processes and well-being. So we collected some data. We collected some questionnaire data. We had a total sample size of 61 young adults that participated in this study. In terms of the method, this was just a one-time questionnaire. Our eligibility requirement is that young adults had to be diagnosed with cancer between the ages of 18 and 39 within the past 5 years. We recruited widely across a bunch of different cancer-related organizations. So obviously we recruited through the Army of Women. We recruited through Grit Health, which is a digital health app and platform that was founded by members of the young adult cancer community. We also recruited through Lacuna Loft, which is a young adult cancer organization that provides wellness support and resources. We recruited through the Young Survival Coalition, which is a breast cancer support organization focusing on young adults diagnosed before the age of 40. And then we also recruited through the Pennsylvania Department of Health, so their cancer registry, getting young adults that were diagnosed with cancer in Pennsylvania. I just wanted to mention, I know Crystal had mentioned before we started, but in terms of recruitment through the Army of Women, we recruited through social media posts and e-blasts that were sent out between January and March of 2019. I just put kind of a sample up here of what these social media recruitment looked like. I think this was specific to Facebook, but it was on Facebook and Twitter. And about 60% of our sample did come from the Army of Women. And it's encouraging that most of these participants did roll in about 2 months. Which is kind of unheard of when you think about young adult cancer research. It normally takes a little bit of time to get a sizable sample. So I think kind of our recruitment efforts were unique and helpful to get this population. In terms of what we asked young adults in our study, we asked a bunch of questions, but the one specific to this study, we asked them to think about a cancer-related conversation. So this is the exact prompt that they got, to think about the most recent cancer-related conversation that you had with someone from your social network. And then we asked specific questions. We asked, who did you have this conversation with? And these were open-ended, so young adults can kind of respond however they felt. What was this cancer-related conversation about? When did this conversation take place? Was it today? Was it yesterday? Was it a year ago? How did this conversation take place? Was this face-to-face? Was this text message? Was this over social media? And then how was this conversation initiated? Did you as the young adult initiate it yourself, or did your support member initiate this conversation? And then we asked some questions related to social support, which I'm calling these kind of relational processes. We asked questions related to self-disclosure. So we asked young adults to think about during that cancer-related conversation that you had, how much did you disclose information, thoughts, and feelings to your support member? We asked how much they felt that their support member disclosed their own kind of information and thoughts. And then we asked kind of globally to the young adult, how much did you feel accepted, cared for, and understood within that cancer-related conversation? And then we asked about depressive symptoms in the past week and functional well-being, which is kind of just a measure of kind of physical capabilities and kind of access to support networks. In terms of our sample, I just wanted to give you kind of a snapshot of what our sample looked like. The mean age for these young adults was about 34 and a half, although we did have a good range between 24 and 42. Majority of participants were white, married, and educated. In terms of the cancer kind of population, majority of our sample was a breast cancer sample. Most young adults were diagnosed with non-metastatic disease. And the mean months since diagnosis was about 2.5 years. So these are young adults that are about 2.5 years since being diagnosed with cancer. In terms of the cancer-related conversation, I just wanted to present for some information about what these conversations were about and who they were with. So when we asked young adults, how did you have this most recent conversation? Most of them said about 64% said that they had this conversation via face-to-face. In terms of who they had this conversation with, most young adults said that they had this conversation with a friend or a family member. Most young adults said that they had this conversation today or within the past one day. In terms of conversation topic, most young adults are saying we were talking about recurrence or any treatment-related topic and talking about survivorship or follow-up care, which is kind of indicative of the sample. They are 2.5 years post-diagnosis. And then conversation initiated. Close to 2/3 of the sample said that they initiated the conversation themselves. I wanted to kind of walk through our main finding here when we looked at kind of technology-related communication and face-to-face communication. So in terms of motor communication, this is what we found. These results shown on kind of the left-hand side and these graphs are specific for self-disclosure, but this pattern was consistent over the other social support-related measures that we had. I should mention before I dive into the results that for depressive symptoms, lower numbers are indicative of lower depressive symptoms, so lower numbers are better. And for functional well-being, higher numbers are better. So higher numbers represent more kind of functional well-being, which is good. So with that said, I'm going to start by talking about this blue dotted line. These are those that had their most recent cancer-related conversation via face-to-face. You can see that this line really doesn't change that much. It goes up a little, it goes down a little. And really what this is saying is that there's no differences in depressive symptoms or functional well-being across levels of these social support relational processes, meaning that disclosing a little or a lot about how you're feeling or feeling that your support member is disclosing a little or a lot doesn't really significantly influence depressive symptoms or functional well-being when you have these conversations face-to-face. However, moving on to the orange line, you can see that changes a little bit more drastically than the blue line. The orange line, these are these individuals that had their most recent cancer-related conversation via technology-related communication. So what this is saying is that those young adults who disclosed more and felt more connected with their social networks, they had lower depressive symptoms and greater functional well-being when communicating through these technology-related methods. So communicating via social media or via text message. So that was really kind of our major finding for this study, that these kind of relational processes of disclosure and feeling cared for and accepted and understood when expressed and felt in high amounts appear to be advantageous for those communicating via technology-related methods. Meaning that technology-related communication is not so bad for social support, it's actually advantageous. I think technology-related communication, text message, social media kind of gets a bad rap at times. And so the study is really saying that, hey, it's not bad to have these conversations over technology-related means, but what you need to do, you just need to put yourself out there a little bit more. You need to disclose a little bit more. Your support member needs to disclose a little bit more in order for those conversations to really have an impact on well-being. We didn't see this effect for face-to-face communication. It may be that just being in the physical presence with another human being, no matter how much one is disclosing, is protective. In fact, there's a whole decades worth of social support literature that says that just being in that physical presence of another person is beneficial for health. But I do really want to just take some time just to talk through kind of the importance of these findings. So just kind of, putting it all together. So when we think about technology-related communication, it's really transforming the way in which young adults with cancer are interacting with their social support networks. It's providing a platform in which these personal cancer-related concerns can be shared and support can be received without having to be in the physical presence of another human being. In this study, we asked young adults, when you're typically talking about cancer-related concerns, how are you having these conversations? Over 60% of young adults reported that they're typically talking with family and friends about cancer-related concerns over technology-related channels. So even though in this study and when we asked them about their most recent cancer-related conversation, that most said that they had it face-to-face, when we did ask them kind of overall, how are you having these cancer-related conversations, we did find that majority have these conversations over technology-related channels. However, there really remains a large gap in the research literature addressing this kind of changing social network. While we're slowly moving to incorporate technology, advances in research that looks at how these technology tools are supporting young adults with cancer are scarce. When we think about technology-related communication, it really can help support young adults by allowing them to engage in multiple methods of storytelling and support receipt. So this can be through exchanging photos, through exchanging text messages, hashtags, hyperlinks, emojis. So really allowing them to engage in multiple methods of support. However, our kind of support-related communication theories are really grounded in face-to-face interaction. So we need to learn more about how technology-based communication is supporting young adults and how these interactions can be seen as a viable way to sustain and maintain relationships and promote adjustment to a disease. And I mentioned kind of maintain and sustain relationships because thinking specifically about young adults with cancer, it's really important that young adults with cancer maintain a sense of normalcy, maintain connection to their social networks, to their extended family and friends. Young adults commonly report feeling socially isolated from their social support networks. You can imagine these are young adults 18 to 39, 45 years old, where here they are presented with a cancer diagnosis. They might have to leave school, leave their job, go into treatment for several weeks, several months, have even more treatment after that. So it can be a very kind of socially isolating time. So it's really important that what we can do as a community is really to educate young adults about supportive social environments and the benefits of kind of self-disclosure and support member disclosure, as well as surrounding yourself with a support network that you feel kind of accepted, cared for, and understood. Whether this is face-to-face or technology-related communication can really be helpful and protective for health. Kind of shifting back to theory and kind of what we can do as researchers, I really feel like that we need to have development of theory-based, age-appropriate support communication interventions that include technology-related communication. Like I alluded to early, most of our cancer-related communication studies are grounded in older adults, and we need to kind of bring our theories back down to young adults. Really challenging this notion of traditional face-to-face support as a prerequisite for well-being and health, and that communicating through technology, like I mentioned earlier, is not a disadvantage. We can expand into personal health communication theory into this kind of technology-driven domain. With that, I really wanted to kind of close. I was kind of just hoping to give a snapshot and an overview about kind of social support and cancer-related communication around young adults with cancer. I just wanted to end by acknowledging funding for this project. So this project was my doctoral dissertation. I received funding through the National Cancer Institute, through the American Psychological Foundation, and my graduate institution, which is the City University of New York. And then really thanking kind of the cancer organizations that without kind of their generous support, this study would not be possible. And then really thanking all the young adults that participated in the study. So with that, I'll kind of close it up.
Well, thank you so much, Dr. Darabos, for a great presentation and overview of your study. It's very exciting and quite a timely topic, given we're all at this time really leveraging technology to communicate day to day, it looks like. So with that, I would like to open it to the audience for questions. And go ahead and start with, I don't know if Dr. Love is still on the line, if you have any questions.
I'm here. I'm wondering what your recommendations are for the next step. I mean, one is how they work together, but how can they identify what I sometimes call the collateral damage of treatment and how to deal with it and how to take it to the next step?
Yeah, I think that's a great question. I think really the next step, I mean, I think it's twofold. I think one, we have a next step for research to really kind of hone in on what is technology related communication, what is happening, you know, for individuals when they're reaching out via technology. And I think we need studies that look across different modes of technology. So is there a difference between text message and Facebook and Twitter and FaceTime? Really to kind of tease apart, is there one mode of technology that might be more beneficial? So I think that's from kind of the research aspect to really just give a little bit more attention to technology and how it's unfolding, especially for young adults that maybe can't have kind of that face-to-face communication. I think second might be kind of a more healthcare perspective. So maybe educating nurse navigators or physicians or even family members and support members about what is helpful for young adults. You know, what we found kind of from this study is that young adults just want to be listened to, you know, just sit next to me, listen to me, be there for me when I need you. So I think one of the reasons when I started out with this research study was really to understand how young adults are communicating, but understand kind of what they need from social support networks, because I feel like social support networks are so in the dark about how to talk to family, how to talk to friends about cancer. So just from this study, just, you know, it's talking and being there and listening. So I think maybe educating young adults, educating social support networks about what might be helpful for them. I see kind of next steps moving forward. So research side and then kind of healthcare side.
Yeah, and it may depend on the person. I mean, some people may be more word oriented and like Twitter, whereas somebody else is more Facebook and wants, you know, video, you know, and so it may not be as simple as just social media, but it may be getting the right pattern for their personality or needs.
Yeah, and I think that's a great point. There's some work where I was at the Graduate Center. There's some work coming out looking at kind of that emoji use, and some studies have suggested that it's really kind of a match. So if I'm on Twitter or if I'm text messaging with somebody and I give a smiley emoji, that's kind of me saying that you can give me emoji back. But if I don't use any of that and you use it, I kind of feel like you're not listening to me. So I think there's a lot of things that need to be teased apart as well. We talk about, you know, talking through social media, like what's helpful for one person is not going to be helpful for another person. I think that's a great point.
Thank you so much. I have a question. So, and this is more in regards to your methodology. So I I failed to capture the name of your measure for depression, but I did notice that it was not the PHQ-9, and I was wondering what drove your choices in that measure.
That's a really good question. So I use the CESD. It's the Center for kind of Epidemiologic Studies Depression Inventory. I think that's just what I was trained on. Like, honestly, I don't think I have like a rationale for using that. There's a 20-item measure and there's a 10-item measure. So I did use the short form for the 10-item measure. But I'm pretty sure that when they've done studies that there's pretty high correlations between the PHQ and the CESD. I think it's just, I mean, just for me, I think it's just a matter of that's what my advisor used in his studies.
No, that makes sense. Well, and kind of my background, we use PHQ-9, and that's, and working in hospitals, that was often the most frequently used one. And so I was just curious. So I get to become more familiar with the CESD. And like you said, there's been tons of literature on all of these standardized measures in depression, and they all highly correlate. So
yeah, I think this is
I'm always really curious as to how researchers choose and kind of what drives the choices.
Yeah.
So okay. Well, thank you for that. And then like another thought that I had of like what might be some of the underlying mechanisms for getting your really interesting results about how these technology communication services can support well-being. And like, I'm thinking like perhaps, when you're the receiver of communications via technology, the perception is listening, right? Like the default is that you can't interrupt a text communication necessarily, right? It's like you kind of have an audience that's sitting there waiting. So unlike a face-to-face dialogue where somebody might jump in and not let you finish, I wonder if there's this kind of underlying mechanism that it facilitates this perception of mindfulness and mindful listening. I don't know.
That's a really interesting point. And I think kind of what we might have to do to move this research forward is to really take this as kind of like an experimental paradigm and kind of look at, I always feel like, when you're having communication via specifically text message, right? You're sending a text message, but you don't know if that person's going to respond, or you have that, did they read it and not respond? So I feel like on some level, it might induce a little bit more anxiety, especially when you see those little ... dots, if you have like an iPhone. So I feel like on one hand, it can kind of create this, like you said, like this mindfulness experience of, this person is really taking the time to listen to me deeply and feel what I have to say. On the flip side, it can be a little kind of anxiety provoking. So I think to move this research forward, some of the older adult, and I use the term older and not to mean like, elderly, but kind of, the 40, 50, 60, that kind of literature, what they've done is they've kind of invited people into the lab. They've invited a diet into the lab. Most of this research is done with spouses. So they invite spouses and married couples into the lab and videotape them having a conversation. So I imagine that if this, work is going to move forward, that we might invite people into the lab and have them have a text message conversation, or kind of a conversation over social media, one person in one room, another person in the other room, and look at those interactions. I did that with an undergrad sample, not with kind of a cancer-related sample, and we're looking at those results now to see, are there differences via face-to-face and text message communication that way. So we really have to take this kind of experimental observational approach, I think, to really tease apart those mechanisms and what might be happening.
Yeah, I agree that there's really a wealth of opportunity to explore with this topic. It's all so new. With that, I actually also wanted to ask and mention, have you looked at or heard of any of the research revolving really the youngest generation and emoticon use? I know that some linguists are actually becoming very interested in how a whole new language is really emerging by uses of emoticons and things like that. So I think that that's a really interesting thing that you might want to look into as, as everybody kind of ages into technology, kind of what does that mean for the horizon of technology, communication, and healthcare for the future?
Yeah, and I think I mentioned that this undergrad study that we did, what we found too is that people were sharing GIFs back and forth. like pictures and stuff. And we were like, oh, how do we even code like those GIFs? So it's even a whole new analytic language that we really have to think of. Like, especially when you start thinking of emoticons with like a half smile, then a full smile, and then like a sad face, like how are we quantifying that?
Right.
So I think in the next several years, it should be really interesting to see statistically really where people are moving with this and how to quantify social media language.
Right. It's really fascinating. And like I said, what a timely discussion, all of this.
Yeah.
All right, with that, I want to open it up to the crowd if there's any more questions. The default is to be muted, but you can go ahead and hover your cursor if you're on the web. Hover your cursor over the screen, and on the left corner, you will see some icons to unmute yourself. So I'll give it just a few more minutes to see if anyone else wants to pop in with any questions. All right, okay, and with that, it doesn't look like we have any more questions. Again, thank you so much, Dr. Darabos, for choosing the Army of Women as a recruitment resource. We're so happy that you found it supportive, and thank you so much for coming back and sharing with us the results of your study, and we really look forward to seeing what's on the horizon for you and what's next, and we see you as a partner always in pushing this research forward, so thank you so much.
Thank you.